So, we're going to be discussing nurses' mental health during the COVID-19 pandemic using an evidence based approach to address mental health changes. So, here we're going to be discussing the overview of the project, critical issues of mental health in nursing, project goals, smart objectives, research design and methods, evidence based interventions, step by step implementation, measuring success, expected outcomes and implications, summary and final thoughts, and questions and answers. So the overview of the project. So the COVID-19 pandemic definitely significantly impacted the mental health of nurses. There was heightened stress, increased workloads, and exposure to high levels of patient suffering. Addressing mental health is crucial for both nurse well-being and patient care quality. As we well know, the well-being of nurses directly impacts patient care. It's integral for their job performance and patient interactions, making it essential to address this issue comprehensively. And so the research question is, how can evidence-based interventions improve nurses' mental health? So the critical issue of mental health in nursing. So why does this matter? Well, nurses faced increased rates of anxiety, depression, and burnout during the pandemic. They reported that 50% of nurses actually experienced high levels of stress, with inadequate support systems contributing to these outcomes. The World Health Organization also emphasized that the importance of mental health support for healthcare workers is crucial for maintaining a functional and effective workforce. There is a need for targeted evidence-based interventions to address these issues. Ultimately, improving mental health among nurses is expected to enhance job satisfaction, reduce turnover, and ultimately improve patient care and safety. So project goals and SMART objectives. A structured approach to address mental health basically is to assess current mental health status of nurses. This can be using validated instruments and to design, implement evidence-based interventions aimed at alleviating stress, anxiety, and burnout among nurses. Evaluate effectiveness and develop long-term support practices. These objectives are structured to be specific, measurable, attainable, relevant, and time-bound. And that is your SMART objective, ensuring a focused and practical approach to addressing these mental health challenges can be identified. So research, design, and methods. There are different quantitative surveys such as the GAD-7, MBI, to measure anxiety, depression, and burnout. These help measure not just anxiety, but depression and other PTSD symptoms as well. This qualitative component will include semi-structured interviews to gain deeper insights into nurses' experiences and perceptions of the interventions. This approach is suitable for providing a comprehensive understanding of both numerical data and personal experiences. So evidence-based interventions. So mental health workshops can help with stress management and coping strategies. Counseling services will provide support for those with experiencing severe mental health issues. Peer support programs will offer a platform for nurses to share their experiences and provide mutual support. This intervention aligns with recent evidence that emphasize the effectiveness of multifaceted approaches in addressing mental health issues among healthcare workers. So step-by-step implementation. So this is a phased approach over 6 months. So phase 1 involves planning and preparation, including securing necessary resources, training facilitators, and engaging stakeholders. Phase 2 includes the execution of the intervention, such as conducting workshops and establishing peer support groups. Phase 3 focuses on providing ongoing support and evaluating the intervention's impact. Some potential barriers could be resistance to participation, resource constraints. This can be addressed through proactive communication and flexible adaptation of the implementation plan. So measuring success, evaluating the impact of interventions. So this will be evaluated using a combination of pre- and post-intervention surveys to measure changes in mental health outcomes and job satisfaction. Data will be analyzed using statistical methods to assess the significance of changes. Qualitative data from interviews will be analyzed thematically to identify common themes and insights. Ethical considerations will include ensuring there is a conformed consent, confidentiality, and the right to withdraw from the study at any time. So expected outcomes and implications. So positive changes in nursing and healthcare. So there has been an improved mental health and job satisfaction among nurses. There is a reduced burnout rate and stress levels. Overall, quality of patient care has improved as well. By implementing these interventions, the project will aim to foster a more resilient and satisfied nursing workforce, and this is really crucial for maintaining high standards of patient care. Expected implications include increased nurse retention, improved patient safety, enhance the cost effectiveness of healthcare delivery. So really addressing these mental health issues effectively will contribute to a more sustainable and efficient healthcare system. So summary and final thoughts, moving forward with evidence-based practice. This project really aims to address a critical issue of mental health among nurses that were not only affected by the COVID-19 pandemic, but from increased stress and burnout levels. Through a structured approach involving assessment, intervention, and evaluation, this project seeks to enhance nurses' well-being and improve overall patient care quality. The significance of this project really lies in its potential to offer more practical solutions to a pressing issue, therefore making more meaningful contributions and helping improve healthcare delivery. Implementing specifically evidence-based interventions is really essential for improving both individual nurse outcomes and overall healthcare effectiveness. And these are references.